sure, 10 people can create kind of an atmosphere of like, this is really good. When you have a third of the sworn officers that can do that, that's kind of a shift.
Many of us encouraged each other to take the Sigma test. It just being offered as an opportunity opened a lot of eyes and encouraged many people to be healthier in order to be able to serve the community for a longer time and be healthy while doing so.
I'm Rhonda Kelly, Executive Director of the All Clear Foundation. We leverage the power of strategic partnerships to create effective solutions that improve the well-being and the longevity of emergency responders, those who serve our communities.
Every chance that we have to show our officers that they are valued and supported both inside the organization and outside is critical, and programs such as this have really helped go a long way in letting officers know that we value their well-being, we value their service. And the support of organizations like Sigma and All Clear and getting these programs like this accomplished go further in helping us show those officers that we value them.
My name is Dr. Benjamin Stone. I'm the CEO and co-founder of Sigma Tactical Wellness. And what Sigma has developed is a comprehensive cardiac screening program designed exclusively for law enforcement that's not only confidential, it's vetted, evidence-based, and it's designed to impact the officer, and not just in medical circumstances, but there is a strong lifestyle change component that's designed to prevent diabetes, hypertension, obesity.
Offering a program like this by an agency definitely can build a healthier agency and also help in retention. And the reason why I say that is because when you look at retention of the officers, it's usually officers aren't leaving. We're not chasing money to go to another department. Opportunities are pretty much the same. So it's more of like, do I feel like the agency cares about me? And when you're able to offer a program like this, and especially when it was through the All Clear Foundation, it was able to be offered cost-free, I think that tells the officers like, hey, we care about you.
Going through the program, it was very well explained by all the doctors and everybody that was involved. They're very friendly, they were very thorough, and they really laid it down in layman's terms. I know you may go to the doctor and get a physical and they'll tell you what your blood sugars are or your cholesterol, things like that. But this program actually breaks it down even more and talks about how those things affect your body and how you can burn fat and not just calories and the difference. And it breaks it down on where you need to be. Because I never knew where I needed to be to burn fat or calories or anything like that. And it was explained to me. And now I know if I wanted to lose weight, where I needed to go and what I need to do. So it's not just about diet or exercise, it's talk about the actual physics of your body.
And then there were other people that were like, I knew I had some issues and this really brought it. Now I can see all the information. It's not just simply like, oh, you have high cholesterol. Now I've got so much more knowledge about it that when they've went back to their primary care physician or their cardiologist or whatever it may be, they're armed with information.
As a participant in this program, I was really pleasantly surprised with how thorough and personalized the experience was. I had previously discussed some flexibility in scheduling. That personally helped for me, accommodating for some scheduled vacations and other obligations that I had existing. And I have been, for my entire life, involved in fitness activities to various degrees pertaining to sports leagues, weightlifting, and running. And I was really impressed with the personal experience of the physicians and the staff from Sigma and All Clear in working with me to customize and tailor a nutrition and fitness program that I was able to use and continue to use since being a participant in the program.
If you know where you stand in your health, then you can do something about it before it's too late.
And so when we put this program together, there's really two outcomes. Number one, that officer leaves with a clean bill of health. Or number two, they know exactly what's going on, why, and then most of all, and most importantly, they leave with a strategy on how to deal with it and how do they improve upon these things that we find. And a lot of times, again, we've never seen a patient that's come down the pike that's not been intervenable.
It's your gold standard of a total benefit package, and I couldn't have been happy to have brought this to the Edgewater Police Department for our staff.
Feedback from staff did include some of the same feelings that I did. There are some participants with whom I've worked for many years that we've participated in exercise regimens together, and they were also very impressed with the customized and personal nature of the feedback they'd gotten from the staff, nutritionists, and others involved with this process. And there are other staff who have not taken as much of a proactive approach to their well-being as I would hope, but that they took that first step by participating in this program, educating themselves about their health and some of the possibilities, and are using those now to better their own well-being.
The diagnostics that Sigma Tactical Wellness uses to undercover risk, especially cardiac risk in our law enforcement populations, is 100% vetted by the American Medical Association. It's evidence-based practice, it's published in peer-reviewed data, and it is specific to the hazards and the occupational rigors that you see within the spectrum of law enforcement. When we have an officer that comes through our program, the number one thing that we emphasize in our program is education. We want these officers understanding that, listen, you're not like a typical civilian. We can't treat you like a civilian. We've got to make sure that you understand the risks of your occupation and how that's going to be prolonged over 2 or 3 decades of service. But we want you to understand exactly what you can do in order to circumvent that risk so it doesn't have a premature shortening of a life event.
But it was explained to me very well, and like I said, everybody was very friendly, and they talked about what I needed to do to make myself better. And they didn't judge you, and they don't force you to do anything, but it's an open experience, and it's an open talk about who you are and what you are and how to do better. It was great.
We're looking at your health care, and we're going to provide a test for you. And it's going to be confidential, and the officer's going to have be the one that have that information. I don't think it could have been any better. You know, we benefited from that, and the morale has benefited from that. The officers have benefited from that. The families have benefited from that.
As officers providing service to the public, it's sometimes forgotten that we're human beings, and programs such as this that help us be better advocates for our own health are very impactful to us personally, to our families, and I think also to the community who wants to see supportive actions taken that advocate for law enforcement. And learning about this program and being able to participate in it firsthand really helped me, again, feel supported and also give me one more tool to take a proactive approach to my own health.
Our program is very educational. It's delivered on site, which is an incredibly important component for officers because time is a very, very precious commodity. But for us, you know, we are tired of seeing officers paying for the years of service with their quality of life and longevity, and we're here to do something about that.
Built by responders for responders. All Clear Foundation has your back.